Yeah, so in this study, what we did was our goal was to try to identify any risk factors or any changes in the blood of patients who develop myocarditis while on immunotherapy compared to those who don't. And so to try to investigate this problem, what we did was we recruited and collected blood from three patient groups. Group A were patients who received immunotherapy and did not have any side effects, no autoimmunity. Group B were patients who received immunotherapy but did develop some non-cardiac autoimmunity, such as hepatitis or thyroiditis and other in different organs. And group C were the patients who received immunotherapy and then went on to develop myocarditis. And when we collected blood from these patients and we performed single-cell multiomics on the blood, so this was single-cell RNA-seq, single-cell TCR sequencing, as well as feature barcoding, SITC, as well as mass cytometry or cytoph. What we found was that the blood of the patients who had myocarditis actually had an expansion in a particular type of T-cell called the TEMRA CD8 T-cells, and that these T-cells exhibited characteristics that were suggestive of their function in the role of the disease. So for instance, they exhibited high cytotoxicity markers, high activation markers, and other markers that were suggestive of activation of different pathways in autoimmunity. And so now, as a follow-up, we're doing studies in our mouse model of myocarditis to try to follow up on the mechanism of how these T cells may be contributing to the disease. In our study, we also did do immune profiling on the mouse model that we have. So this is a PD-1 knockout mouse on top of a lupus-like autoimmune MRL background. And these mice, by 4 weeks of age, get very sick. They get myocarditis, and they show, just like in the human disease, they have T-cell infiltrates in the hearts. And so what we did was we collected heart and blood from these mice, and we isolated immune cells and did the same pipeline, single-cell RNA-seq, TCR sequencing, and SITC on the blood and the hearts of these mice. And what we found was very similar to our findings in humans, that these mice had an expansion in cytotoxic effector CD8 T-cells, both in the hearts and the blood. And in particular, one of the most striking findings, both in our patients and our mice, is that these T cells are clonally expanded, meaning that they are reacting to some antigen, and this is what we're working to try to find out now. But they are clonally expanded to certain antigens that we think may be targeted towards, the antigen may be in the heart, and these T cells are targeted towards the heart. So I think this is a very kind of hypothesis generating, but also kind of exciting preliminary finding. And so, and important as well, because, our ultimate goal is to try to find drug targets that we can, go after to try to prevent or cure autoimmunity, especially in the heart of patients who are receiving immunotherapy, because this is one of still, cardiac autoimmunity or myocarditis is still one of the biggest things that prevent successful or safe administration of immunotherapy.